recent study of British women by the research group One Poll found that 25% of the women asked said they first started to think about cosmetic surgery between the ages of 10 and 15 years old. A local doctor answers some of the most frequently asked questions about going under the knife. Breast augmentations are the #1 cosmetic surgery procedure. Do breast implants, though, make mammograms more difficult to interpret breast cancer?
Most recently, there's been a study done that shows that actually women with augmented breasts, with implants in place, believe it or not, in a large study, were actually found, their breast cancer were found more often than they were in non-augmented patients. Now, it's not saying that implants confer any sort of protective, mechanism, but what they were assuming was, number one, the women that have augmented breasts were probably a little more diligent about their self-breast examinations. Additionally, it's possible the implant pushing the breast forward may make it a little easier to detect rather than obscure. The truth is, in all the studies that have been done, there's been no concern whatsoever that implants obscure or diminish the detection of breast cancer.
Local plastic surgeon Deluca says the #1 thing you need to do before having any elective surgery is do your homework.
We found that in the past, people haven't done as much research when they're researching a plastic surgeon or a procedure than they have for, say, something as simple as shoes or furniture. And right now, it's extremely important to understand that board certification by the American Board of Plastic Surgery, ABPS, is the most important criteria, because any plastic surgeon that is boarded by this entity has done all the rigorous training required to be a plastic surgeon that's board certified in this country. And that's probably the most important thing to understand.
To find a board certified plastic surgeon in our area, just log on to WFLX.com and look under Top Headlines.